Good morning. I will be presenting a study entitled An Age-Structured Model of COVID-19 Transmission with Optimal Vaccination Strategies in the Philippines. This paper is a joint work with members of the Modeling and Application Group of the UP Diliman campus, and the names of our members are listed below. Our discussion will go as follows. First, we present an age structure compartment model for COVID-19 with an unreported infectious case class that describes the spread of COVID-19 in the National Capital Region, or NCR, in the Philippines. We then describe the contact matrices used in defining the force of infection. This is followed by a discussion on the parameter values. We formulate optimal control problem and then employed optimal control theory to identify the best vaccine allocation to the 3 age groups. Finally, we present our summary. This modeling study focuses on the COVID transmission and vaccination rollout strategy in the National Capital Region, or NCR, in the Philippines. This is because NCR, or Metro Manila, is the center of economy, the most densely populated region, composed of 16 highly urbanized cities and 1 municipality, and it is where the first 2 confirmed cases of COVID patients were reported. The vaccine rollout for COVID-19 in the Philippines started in March 2021. However, the limited vaccine supply required an optimal distribution and allocation. We need to identify effective control strategies based on optimal control theory. To model the COVID-19 transmission in NCR, a deterministic SEIR compartmental framework is considered, incorporating unreported infectious class. So we have here 5 states in the model. We have the susceptible population, exposed population, reported infectious class, unreported infectious class, and the recovered population. A susceptible individual proceeds to the exposed class through the force of infection lambda. And an individual who is tested and recorded as virus positive is then moved to the reported infectious class due to the reporting rate rho and latency rate alpha. The unreported infectious class consists of infectious individuals who are not reported due to the absence of testing brought about by socioeconomic burden, underreporting, and/or misreporting. Finally, the infectious individuals will proceed to recovery class R at the recovery rate gamma, and the death rate is mu. And since the risk severity of COVID-19 cases and vaccine program of the country depends on ages, so each epidemiological class is divided into 3 age groups. The young age group from 0 to 19 years old, adult is from 20 to 64 years old, and elderly is from 65 years old and above. This subscript I here denotes a particular age group. This grouping is consequential to the following protocols implemented by the Philippine government during the country community quarantine placed into effect since March of 2020. The young age group from 0 to 19 years old comprise mainly of students whose social mixing is impacted by the suspension of face-to-face classes. And the adult age group, the majority of them are considered as the working population who are authorized to attend to the basic needs of their families. And the person who belongs to the elderly age group, they are prohibited to go out of their residence except for unavoidable circumstances. Our H-structured model describing the COVID transmission dynamics can be described by coupled differential equation. For instance, the movement of a susceptible individual to exposed population through force of infection lambda is described by this ordinary differential equation. And of course, the dynamic of the exposed population is described in this second differential equation and so on. Here we define our force of infection. The force of infection lambda is influenced by transmission rate and also contact metrics. For each H group I, the force of infection is given by the following formula. And here, beta is the transmission rate for each H group. And sigma j, this is the contribution multiplier of unreported cases to transmission. And of course, capital N is the total population of H group J. And del C sub ij, this is a contact entries of a contact matrix. And this C sub ij is computed by using this formula, the sum of these four terms. Here, the C sub ij, as I said, they are entries of the contact matrix capital C, and this is a 3x3 matrix, denoting the interaction between an H group I with another other H group J. And the coefficient here are VH, VW, VS, and VC. They correspond to the implemented contact intervention in households, in workplaces, in school, and communities, respectively. I will explain later on. So we assign value to VH, VW, VS, and VC. Now I will explain how we obtain the contact matrix capital C, the 3x3 matrix. So we first consider four 16x16 matrices beamed in 16 H levels. So the first level is from 0 to 4 years old. The second is from 5 to 9 years old, and so on. And the 15th H level is from 70 to 74 years old. And the 16th H level would be 75 years old and above. For the household, DH, workplace, DW, school, DS, and community, DC. So on the left side, you can see the metrics, DH, upper here, and then this is DW, and this is DS and DC. And the values, the entries, they can be obtained from the paper by Prem at LAT entitled Projecting Contact Matrices in 177 Geographical Regions, an update in comparison with empirical data for COVID-19 era, published in 2021. And the sum of these four matrices is equal to the matrix capital D. And so when you sum up, so this is the total contact matrix, and you can see that the intervention or interaction within, there's a strong interaction within the same age in the different location. So this metric shows a pre-pandemic view of the number of contacts in the K age group with a certain L age group population in the Philippines. So we reduce the size of these matrices D from 16x16 to a 3x3 matrix, which we denote by capital C. That clumps together into three main age groups for the young, the adult, and the elderly population. And capital C sub ij can be obtained by using this formula. Or here, we clump together the 16 H levels to obtain only three H groups. So the first one is level H level 1, 2, 3, 4 clumped together to form X1. So this X1 is the young age group, and then H level 5 to 7, 13, put them together to form X2, and X2 is the adult age group. And then finally, the elderly age group is, we clump together 14, 15, 16. And DK is the population fraction of each of the age level K for D. So here is on the right side, you can see this is now capital C's of IJ in household. This is workplace, school, and community. So these are the values we obtain, okay, using the formula, okay. And of course, so here, how do you obtain the capital C? So on the left side is capital C. On the right side, these are C's of IJH, C's of IJW, C's of IJS, and C's of IJ community. And here the VH is 100% because here we assume that the household members, they maintain in close contact. And for workplace, we assume 50%. And for school, it's 0% because since school had been closed at the start of the community quarantine, and here VC is 50%. So first, we give you the daily reported age-specific cases reported by and compiled by the Department of Health in the Philippines from January to February 28, 2021. So this data, we use this in our study, okay? If you take a look at the first figure here, so this is a histogram of the incident cases from January 1 to February 28. So these are the daily infected cases. And the black one, the black curve, so this is the 7-day moving average to take into account the delay in reporting the cases. And the same is true for adults and elderly. And here you can see that the trend is this is increasing, for the incident cases and also daily incident cases and also for the cumulative cases. And then here, in terms of infection rate, the elderly group has the highest susceptibility to infection at 3.4%. This table shows parameter and initial values for the different groups, which we will use in our computation. So most of the parameter values, they were assumed. So if you take a look at factor, the sigma and also the alpha, we are assumed, okay? And then the others are computed, such as initial susceptible population and also the initial unreported infectious population. And the others, remaining are, of course, they are taken from available sources. And then the only thing we have to do is to estimate transition rate and reporting rate. And this is because these values are country region specific and they are not readily available. So to estimate of course, we want to estimate beta and rho. We estimate them, beta and rho, using the least square method. So we minimize the sum of the square difference between the rho data and the solution of the model using the Latin hypercube sampling to generate the 1,000 initial guesses for beta and rho. So upon choosing the best fit among the estimated parameters, then bootstrapping is performed by redoing the parameter estimation 1,000 times with the best model fit as the data used, including Poisson noise. We therefore come up with this table. So this is the histogram of the distributions of the 1,000 realization in the form of histogram. You will see that our estimated parameters is in violet dots, and then the mean of this mean of that 1,000 realization is in a red dashed line, and then the median is the black line. So you can see that the three of them are very close to one another. Also, we put them in a table form. So here is the table. For transmission rate data, we have the mean is 0.0051 and the median is 0.005256 and so on. So one can see that the transition is highest among the elderly at 0.0284 and the least among the young group. The young age group is at 0.0056. And then for the reporting rates, of course, the elderly group has the highest value because the elderly are more likely to experience severe symptoms than the younger age group. Here, this picture, we show a comparison among the raw data and the model output. And the model here is using the estimated parameters. So here, the black dots, these are the raw data here. And then the black line, this is the 7-day moving average. And the model estimations, the 1,000 of them is this one, the blue one. This is for the young population. And here we zoom in to the last day, February 28, and compare the raw data and the model output using the estimation. With, of course, this is with 95% confidence interval. And here we have the same thing also for the adults and also for the elderly. It's hung. Hello, it's hung. No? So let me repeat it again. Okay, could that move no? To the next slide. Where's the person in charge? Hello. I have to close it and then. Oh, okay. It's still, can you see that? Okay, okay. All right. So it's a structure SEIR model with vaccination. So vaccination is incorporated as a control U to obtain the disease control model. So vaccination is incorporated as control U to obtain the disease control model. So this is the disease control model. And the here data I denotes the vaccine efficacy for the age group I, and use of I denotes the vaccination efforts for age group I. Okay, so optimal control theory is employed to identify the best vaccine allocation to different age groups. Our optimal control problem is this, no? So we want to find controls use of I's that minimizes reported cases, that's the I to the R, and the unreported cases, that's I to the U, and the cost BI of vaccination implementation. And here the interval from T sub 0 to TF. So this one refers to the period of vaccination effort, and the weights here, WI. So these are weights constant representing the cost required to administer the corresponding age group control measures. And the use of I, the control has a lower bound and upper bound, the A sub I and BI. So A sub I here is the minimum implementation efforts, and BI is the maximum implementation efforts. And here, the controls are expressed as quadratic functions to take into account the nonlinear cost for the implementation of each control. Now, the use of I, if UI is 0, it suggests that no vaccination effort is employed. And when UI is 1, so this denotes the maximum effort is exerted for vaccine administration in the corresponding age group. So the period from March 1, duration from March 1, 2021 to February 28, 2022 is divided into 3 periods. This is 1 year divided into 3 periods. And of course, this is in accordance with the vaccination program of the government. So period 1 is from March 1 to June 6, 2021. And vaccination was administered for elderly only. And for period 2 is from June 7 to October 14, 2021. And vaccination was administered for both elderly and adults. And for the third period, vaccination was administered for all age groups. This is from October 15, 2021 to February 28, 2022. So here, these are the values we use in our numerical simulation. And as you see, the minimum daily vaccination R, that is the AI, are these values for the three age groups, and the BI are these values for the three age group and also for the three periods. And the weight parameters, we assume them to be this value, and they are chosen to improve the balance of the terms in the cost functional, specifically the controls and the order of magnitude of the infected population. So after numerical simulation, so we arrived at these optimal control profiles. The controls here, the U1, U2, and U3, one can see that in the first period, the elderly, the use of 1 is equal to 0.01, and then second period increased to 0.03, and then in the third period increased to 0.1. And as for the adults, in the first period, 0 vaccination, so U2 is 0, then in the second period is equal to 0.01, and the last period is 0.1. As for the younger age group, the control is 0 in the first and second period, and then in the last period is equal to 0.1. So some notes of optimal control strategies. We have the following. So once vaccination becomes available to a particular age group, the initial maximum value for the control is low, and this is due to because the vaccination rate for the first period of implementation is low due to the adjustment in the implementation. And this will increase in the succeeding periods. And in period 3, it is assumed that vaccine supply is sufficient enough. And once vaccination is started for a particular age group, implementation is continuous even if they are not the priority group. And Pontryagin maximum principle is applied to find the optimal controls and numerically solve using forward and backward sweep method. And here again, we present the effects of optimal control on infectious cases. We can see that the control significantly reduced the number of infected cases. So if you take a look at this figure, look at the yellow one, the red one. So the red one is, of course, the adult age group. So without control, the adult age group, the infected cases can reach up to 317,640. And with control, the peak here is 66,178. And similarly for the young age group, without control, the peak is at 128,509, and then with control, peak is around 29,831. And similarly also for the elderly, so without control, it reached 31,208, but with control, so here is the window for that one, the peak is 3,265. Here's another figure to explain the optimal control results. And we compare this with the actual data of infected cases with implemented government intervention. So if you take a look at the left panel, here with control is in blue line, and data is in black line. Data is the actual data. Okay, so the actual data of infected cases is in black line, and then the dotted, the dashed line is the without control. So one can see that the actual infected cases is very close to the optimal control results. And here also in the adults age group, The red one is the with control, the red curve. The black curve is the actual data of infected cases from, of course, from March 21 up to February 28. And so the black and the red are very close. And also the for the elderly age group, the yellow line and the black line. And the panel below, okay, the lower panel shows the accumulated cases also at the end of each period, no? So the first part, at the end of the period, one can see the infected cases, the infected cases went down, okay, 29%, decreased 29% in the first period, even the elderly, they were not given the vaccine. And then for the adults, also went down 30%, and elderly went down 31%. At the end of the second period, where the adults were allowed to get the vaccine, so the decrease is even larger, no? So from 29 to 71, and then for adults it's also 71%, and for the elderly is 74%. And in the last period, in the third period, where everybody, where all the three age groups were allowed to get the vaccine, so it decreased 79%, 81%, and 84%. So here is our summary. So an age-structured model for COVID-19, incorporating and reporting and varying levels of interaction across age groups were developed and then used in estimating the transmission and reporting rates for each of the age groups in the pre-vaccination period. A contact matrix is used to incorporate the interaction among individuals across various age groups, and the formula for force of infection included entries of contact matrix. Reporting and transmission rates are estimated because they are country region specific and they are not readily available. Estimation was performed using a least squares formulation by fitting the model to the cumulative case data. In the optimal vaccine strategy, it was shown that generally the controls must be at maximum except towards at the end of the period, where the vaccination for elderly can be lowered first, followed by vaccination in the adults, and lastly, vaccination for the young. The optimal vaccine strategy results to significant decreases in infectious cases in all age groups. The aim of this study is to guide the policymakers in drafting strategies that can mitigate the spread of an infectious disease, considering age-dependent transmission and limited vaccine supply. Although the model is tested using Philippine data, the model is general enough that it can be applied to other regions with similar situations. Here are the references. And the preprint for this project is available on NetArchive and can be accessed using the following QR code. This project was supported by a grant from the University of the Philippines Computational Research Laboratory. Thank you very much for listening. And here I show you an aerial view of our campus, University of the Philippines Diliman campus. And here in the center is our administrative building. This is entrance to the university, and you can see the buildings around. And here, this is our zoom into our administration building. We have the oblation here. And this is the science complex located inside the campus. And our math building, here is the math building. Okay. So you're all welcome to visit our university. Thank you very much again. Thank you.